My name is Raj. I'm a reader of The Communist, and I wanted to share some of my experiences of working in an accident and emergency department with the news coming out with the RCN report. I think one of the things that has been most damaging is seeing the effect on patient care with the overrun A&E departments, ambulance queues, and so on. There's a process called boarding that often happens where, because there's not enough space in the right clinical areas for each patient, that new patients who are brought in are treated in random corridors or corners of the department. And there were even times where I, as a doctor, would have to take a medical history from a patient in the waiting room, surrounded by other people, having to talk in hushed tones or even writing down questions on pieces of paper. Ultimately, these sorts of things strip patients of their dignity. When we have to deliver emergency care to patients in corridors, it can be traumatic not just for the patient, but also for their family. And we find that these patients have reduced access to things like oxygen or cardiac monitors. But it's a sort of unspoken secret in the NHS. No one is ignorant to the reasons why we have to work in these conditions. It's something that we talk about every single day. The fact that there are not enough ambulances to pick up patients, and that when they do pick up patients, they're often sicker because they've had to wait longer, that there aren't enough beds in the NHS, not just in the A&E departments, but also on the wards, which cause blockages, and the fact that there aren't enough doctors, nurses, and other essential staff to deliver care and get patients the treatment they need as quickly as possible. We know that's because of austerity. We know that's because of privatization, because we see it directly in our face working in those environments. We know what it's like to work with fewer resources or worse resources, to have pressure from management, often with no clinical training, telling us that we have to see this many patients, diagnose that many patients without having any idea of what we're able to actually do with the resources that we have. So yeah, absolutely, it is to blame on Tories, Labour, the private sector parasites, and every capitalist who has stripped the NHS through austerity, sold it off to their mates through privatisation, and yet has the gall to complain when doctors, nurses, and other healthcare workers go on strike, not just for our salaries, but also for the safety of our patients,